breast reduction. And being in an older age group, having surgery and having scars and complications that may come in the healing process is how I came across Marjorie. My plastic surgeon, who's absolutely wonderful, recommended her. There are other procedures that can be used, but he said, this woman is phenomenal and you are going to absolutely love her. I've seen her work. She does take insurance. That was one of the perks. It's out of network for me. And he's like, she has magic hands. And he goes, I can't believe what she does. And this doesn't require laser therapy or anything like that. And it's deep tissue. It goes beyond the surface, which is amazing. So I said, okay. I was like, I'll try her out. I contacted Marjorie. She was very quick to get back to me. And we set up an appointment. The health issues that I had before I went to see Marjorie is I started developing fat necrosis in the breast after my second breast reduction, which I didn't have the first time around. And again, age has a lot to do with that, and the previous scar tissue underneath. So going into a mammogram with fat necrosis now in the breast is a little scary. Because all of a sudden they start seeing all these images on the mammogram and they come up as, possible, I don't want to say cancer, but, irregular masses, even though I explained to them that it's fat necrosis. They still maybe come back in for a second mammogram and, talk to other people. And then when a specialist looked at it, they understood that it was fat necrosis. Now, having said that, and speaking with the plastic surgeon, again, he said this is where Marjorie can also help. And that was a health scare for me, if you will, having to constantly, go in for mammograms and having all these irregular images coming up as a result of fat necrosis. So one of the skills that Marjorie has is reducing, if not eliminating, the fat necrosis. What attracted me to trying Marjorie is that I did have a earlier breast reduction when I was in my mid-30s. And after that breast reduction, the recommendation for the scar therapy was going in for laser therapy. So I had already been down that road, and the technology then, that's what was offered, and it did help. I'm not saying that it didn't. It did help tremendously. But going through a second breast reduction, and having scar tissue upon scar tissue, because of the previous surgery, it seemed as though what Marjorie had to offer with her massage therapy and other things that she uses was an alternate process to healing. And it wasn't just zap, zap with the laser, you're in, you're out. She actually uses a technique that goes beneath the surface and starts from the bottom up, if you will, not top down. So it's down, it's from the inside out, not outside in. The first couple appointments, well, the very first appointment, I should say, immediately the color of the scar on the surface basically dissipated. Whatever redness was there, whatever rawness was there, was gone. And this is through her manipulation with the machines that she uses and with her hands. Like I said, she has magic hands. But it wasn't just that, it was a loosening because I felt a tightness and pulling where the scars were and where the fat necrosis was, so after she worked on me for it's about an hour, um, that immediately I walked out feeling like, oh, I don't feel that pulling. I don't feel that sensation anymore. And just looking at the scars, it was visibly remarkable. The biggest factors is I have less discomfort from the pulling of the fat necrosis and the tightening of the scarring, which has now been loosened. I don't know what the right word is. It's more malleable, I guess, softer to the touch. It's just not pulling in any one area. Her therapy has definitely exceeded my expectations. And having said that, even though you may not be able to go every week, I mean, it is great if you can, but I had to take a time period off um, due to the birth of my granddaughter. So I was away from her for about a month, but it didn't inhibit or prevent progress in the therapy when I went back to her. I love the Zen experience. It's an amazing office to go into, very unique and very different from any other place you've been. You go in and you just feel peaceful. So whatever's happening to your body, it's just a very warm, inviting place. And she does have different rooms in which to treat you, which, she had an outdoor area, but an enclosed outdoor area. So in the warmer months, you actually get to enjoy her beautiful setup. I can't even describe it. It's something you really have to go see. It's beautiful. Again, after having a breast reduction, there's a lot of tightening there of the scars, the scar tissue. So they're hard. There is a lot going on during the healing. And when I did see Marjorie, it wasn't directly after my surgery, it was a year after. So I probably should have said that earlier. So even with it being a year after, the changes were tremendous and remarkable. And the benefit was immense. I mean, again, not having that pulling feeling, and I don't know if anyone's ever felt that sensation, but when you're wearing a bra and you're walking and you have that movement, and then there's a tugging from the inside, and there's discomfort. So I don't experience that. When you hear the word fat necrosis, most women are like, oh, it has to be removed surgically if you research it, you know? And until Marjorie worked on me and has done what she's done to see, I mean, I had such a large um, fat necrosis in one of my breasts. And I can't, I want to say, and Marjorie probably knows better, that it was probably the size of a golf ball, if not bigger. It's half that size at this point through her manipulation, and it's continuing to shrink. So there is a non-surgery option, which for me, I mean, I'm a believer that you don't need to have the surgery to improve any kind of scar tissue or fat necrosis. It works. The straight method works. Um, and you feel immediate results. Does take time, just like any kind of therapy. It's not overnight. But again, it's a beautiful experience to be in either one of her rooms where she works. The Zen experience and her knowledge, and again, her magical hands, that all stands out. Very warm and inviting. Not a clinical office. There's no waiting room where you're sitting in with other people. It's very private. She explains everything. She's very thorough. And again, magic hands. You walk out feeling amazing. immediately. It's not like, oh, it has to heal now. You're not going to feel the what she's done in a week. I mean, you will, but there's that immediate um, healing that's taking place, and it continues from there. What's interesting about Marjorie, even though I was going to her for the scar tissue and the fat necrosis, and when I would go to her, let's say my hip flexor was out, she's like, oh, she goes, well, I can help you with that, and she would incorporate it in the visit. Or if she said, are there any of the scars that you're concerned about, and it didn't matter how old the scar was, it could have been 20 years old, 30 years old. And she's managed to correct certain things on me as a result. So it's not just, I'm only going to work on this and I'm not going to touch any other part of your body. And she'll release whatever needs to be released at that point, and she knows exactly how the body is connected, whether it's the ligaments, the tendons, the muscles, and why something is happening to you. She's very, very knowledgeable, amazingly so. And I already have to many women who have had breast reductions or mastectomies actually, who've done reconstruction therapy. I've recommended her to quite a few. And